Knowing that you had a study 20 years ago about artificial intelligence, how does it influence the prostate cancer and all the cancers nowadays?
So artificial intelligence has really been the game changer in the last couple of years. Yes, 20 years ago when we had worked on artificial intelligence, really nobody was really paying attention to this. And me and my team, we had an idea to work with a group in the United States to work on artificial intelligence for detection of prostate cancer, because prostate cancer, being one of the most common cancers in man, and by the way, one of the leading causes of cancer death even in Romania, has become a very interesting topic for using artificial intelligence, because you can combine different informations and lever the informations to see what is important, what is not important. 20 years ago, you only had to do a PSA. If your PSA was bad, there was a risk of cancer. If the PSA was good, you went home. Today we know it's not that simple. It depends on your family history, your uncle, your grandfather. It depends on your weight. It may relate to many factors that together give you a risk profile and can tell us this gentleman will have cancer or not. And more even, artificial intelligence can help us identify risk individuals at very young age. For example, not only in prostate cancer, you can identify diseases in a 20-year-old early and be able to prevent these diseases from becoming active in the specific individual. If you have a radiologist who has done 5,000 cases and he looks at the MRI and gives you a diagnosis, it is much more efficient if he's helped by artificial intelligence, who can combine the information of 50,000 cases or 100,000 cases. In robotic surgery, artificial intelligence can give us, as we do surgery, information about complications that may occur. So he may say, oh, if you go this way, there may be a problem, you better go that way.
And in the world, how many patients and doctors do use artificial intelligence in the treatment process?
Well, it's very, very small numbers, but it's increasing significantly. We have been using it for many, many years because we believe in it. But for us, it's more of a help. So it is very important to put it in the right context. Artificial intelligence is not replacing the doctor.
What is your opinion on high-intensity focused ultrasound treatment in prostate cancer?
Well, that's a question that was asked to me 25, 30 years ago as well. It's not new at all. And I think it has been brought back by industry. We need probably artificial intelligence to make the right decision of which candidate will be good for HIFU. I remember in Vienna we did the first cases in the 1990s, and we were very disappointed because we thought it's going to be good for every patient, and it's not. Yes, it is an alternative, but you have to make the selection very correctly.
What are your recommendations regarding screening and lifestyle for the cancer-surviving patients?
As you grow older as a surgeon, you start to understand a little bit that medicine and school medicine, which is like doing surgery and sending the patient home, is not everything. And what we have seen now is that nutrition plays a very important role in preventing, for example, tumors. Animal products are considered to be not very beneficial. Red meat is not very beneficial. And the second thing is stress reduction is very important. We have seen it has a strict impact with immune system.
But in your practice, how often do the persons who survived cancer change their lifestyle completely after treatment, like go to another city, to move to another city, or to change their sphere of work?
Well, it is really interesting that you're asking this question because, frankly, more and more patients are asking these questions. I would say 1 out of 3 patients really changes his lifestyle completely. And that's very, very good.